My brother came to visit me from the East Coast. And one of my good friends said, oh, I can tell he's your brother. Well, you have the same teeth. And I look at my brother's teeth and they're not good. I'm not gonna malign my brother, but it's not good. And I'm thinking, ooh, he recognizes me and my brother because of the teeth. And it bothered me. And I felt that I should make a change. So I went to a couple dentists, and one of them came out with a mock-up of what my teeth would look like. And I couldn't believe he even had the courage to show me what he thought looked good. It looked horrible. And so I was very discouraged. So I came in and I met Dr. An, and Dr. An, to me, immediately gave me the impression that she's a perfectionist. And that's what I was looking for. I was looking for someone who's really going to spend time with me. And she immediately said, look, I really take this seriously. I love doing it. And let's sit down and go over a treatment plan. So I was very pleased with her right from the get-go.
And when he first came, his teeth were crooked, they were stained, and he was looking to have veneers, but to put veneers on teeth that are that crooked, you're not going to get the ideal result. So I explained to him that the best thing for him, it would be to have Invisalign or some type of braces.
Well, I live in Southern California, so I want everything fast and easy, right? So I come in and Dr. An says, well, Paul, you're a perfectionist, you're a little bit of a pain, so we want to do it right. So you're going to have to do braces first. It's going to take about a year. And I had been fighting braces tooth and nail, didn't want to do it. And she said, basically, we have to move around your teeth, create the proper spaces and gaps so the lumineers or the veneers look proper in your mouth. So finally, she convinced me to do the braces. So we did Invisalign. I was really concerned about having something foreign in your mouth and how's it going to affect you, and I have to do speeches for work, and I do presentations in front of a lot of people, and so that was a big concern for me. And after about 2 weeks, and to this point, I don't even know I have them in my mouth. I have them in right now. I feel like I talk fine. I'm not slurring, I'm not drooling, I don't need a bib, everything's fine.
He was patient enough to do Invisalign for 1.5 years, and his teeth looked great. They were nice and straight, and it looked so much better. He almost thought, do I need to take that extra step? But then he did, because he wanted them to obviously have better shape and be a little whiter, and so we chose to go on with our veneers. We discussed a couple of veneer options for him. One would be the traditional veneers, where you remove about 0.5 to 1 millimeter of tooth structure. And then there was another option, lumineers, which he was very interested in because you wouldn't need to remove as much tooth structure. Well, Paul's teeth looked great after the lumineers were placed. His teeth were now white, just the way he likes it, and they were straight and even, and so he was very happy.
Well, yeah, Dr. An and the staff here, they've been fantastic. And once you get to know me, Dr. An knows me. I don't just say that about anybody. I mean, I really have to believe it to say it. I wanted a dentist who really understood what I was trying to accomplish. And I'm very happy that I found Dr. An.
It gives us great pleasure seeing the wonderful results and the positive changes we see in our patients.